Hi, everyone. Thank you for joining us today. I'm Dee Dee Gardner, the Chief Research Officer for Allergy Asthma Network. Welcome to this afternoon's webinar. Today, we want to welcome Dr. Purvi Parikh as our presenter. We have a few housekeeping items before we start today's program. First, all participants will be on mute for the webinar. We will record today's webinar and post it on our website within a few days. You can find all of our recorded webinars on our website at allergyasthmanetwork.org. Scroll to the bottom of the page to find our recorded webinars and any upcoming webinars. This webinar will be about 1 hour, and that includes time for questions. We will take those questions at the end of the webinar, but you can put your questions in the Q&A at any time. The Q&A box is at the bottom of your screen. We do have someone monitoring the chat if you have questions or need help. We will get to as many questions as we can before we conclude today's webinar. We will not be offering continuing education credits for this webinar, but we do have a certificate of attendance if you need it for your records. A few days after the webinar, you will receive an email with the supplemental information and a link to download the certificate of attendance. We'll also try to add the link to the certificate in the chat. So let's get started. Today's topic is COVID, flu, RSV, how to stay healthy this winter. As winter approaches, it's very common to get sick from respiratory viruses like COVID-19, the flu, and RSV. There are things you can do to protect yourself and others, and this webinar will help you prepare to stay healthy all winter. It is my pleasure to introduce our speaker, Dr. Purvi Parikh. Dr. Parikh is an adult and pediatric allergist and immunologist. She's currently on faculty as a clinical instructor of medicine and pediatrics at the New York University School of Medicine. She completed her fellowship and training in allergy and immunology at Albert Einstein College of Medicine's Montefiore Medical Center. Prior to that, she completed her residency at the Cleveland Clinic Foundation in Cleveland, Ohio. Dr. Parikh is board certified by the American Board of Internal Medicine and the American Board of Allergy and Immunology. Dr. Parikh is passionate about health policy and sits on the Health and Public Policy Committee for the American College of Physicians. She's also the Allergy and Asthma Network's national media spokesperson and has many numerous press and TV appearances on our behalf. Thank you for being here today, Dr. Parikh. I'll turn it over to you.
Thank you. Thanks for having me. So with that, we'll get started. And what's on everyone's mind, which is respiratory viruses this time of year, COVID, flu, and respiratory syncytial virus, or RSV. Next slide. So we'll start with a quick overview of each and then some details about how you can prepare yourself, and then kind of go into some Q&A as time allows. So next slide. So COVID-19, which everyone is familiar with by now, is caused by the SARS-CoV-2 virus. It spreads between people with close contact. We have now over 760 million cases recorded worldwide. Sadly, 6.9 million deaths. And we're just about approaching the 4-year anniversary of the outbreak. I can't believe it's already been 4 years. But a person can get COVID after vaccination, but the whole idea of vaccines are that they protect against a severe illness and death and hospitalizations. And the high-risk populations are people over 60, those with existing medical conditions, obviously also have a higher risk of getting seriously ill. Next slide. So what are the common symptoms? That also has evolved since the early days, thanks much to both the vaccine as well as the population developing some natural immunity as well. But, sore throat, hoarse voice, persistent cough, chest pain, tightness, shortness of breath. Loss or change in sense of taste or smell is less common now, but we still do see it time to time. Headache, sore throat, sore eyes, dizziness, and fevers. People are still getting temperatures at least of 100.4 and higher. Next slide. So prevention. to prevent the spread of COVID-19, avoid crowds, and keep a safe distance from others, even if they don't appear to be sick, because sometimes people can, be carriers, even if they're asymptomatic. Wear properly fitting mask as well. And if you've been sick, it's best obviously to stay home, but always do frequent hand washing as well. Cover your nose and mouth if you're sneezing or coughing to avoid the spread of those particles, and dispose of use tissues right away. If you do develop symptoms, self-isolate so you recover, and contact your medical provider, because we do have therapeutic options like Paxlovid, which might be a option for you. Next slide.
Dr.
Hello?
Parikh,
Oh, sorry. Okay, I lost you for a second.
Yes.
So some of the recommendations, of course, get your COVID-19 vaccine. It's recommended for everyone age 5 and older to get the one updated COVID-19 vaccine at least 2 months after the last dose of any previous COVID-19 vaccine. And those who are immunocompromised may get additional doses of the updated COVID-19 vaccine, which is we discuss on an individual case-by-case basis, because immunocompromise is such a broad term. And then the younger kids from 6 months to 5 years, since they likely don't have any baseline immunity, they need to get 2 or 3 doses, depending which vaccine they receive. So Pfizer is a 3-dose shot, immunization, whereas Moderna is 2. And if previously vaccinated, then they can also get either 1 or 2 doses of the updated vaccine. So you can discuss that with your pediatrician based on the age and other factors of the child. And then, there's been a lot of controversy and sometimes hesitation with mRNA vaccines, even though I think they're a very safe and effective option. The nice thing is that there is another option now if you are hesitant. So for those that are 12 and up who want another vaccine option, there is Novavax, or if you had an intolerance of some kind to Pfizer or Moderna, such as an allergic reaction or very severe side effects, or myocarditis or any of those things. Now there's a lot, luckily, other options as well too. So that's another plus. But this is only for 12 and up. Next slide. So there's 2 main types of COVID vaccines, as we mentioned. There's the mRNA vaccines, and their brand names are Pfizer and Moderna. And there's the Novavax, which is more like our traditional vaccine platforms that we've been using for many years, for hepatitis and flu and tetanus. This is more of a protein-based vaccine technology. So the Moderna or mRNA vaccines are basically the way the messenger RNA works is that it's a molecule that contains the instructions or a recipe that directs your cells to make a protein using its national machinery to enter cells smoothly, as well as have this protective bubble called the lipid nanoparticle. And so once inside, those instructions are delivered, and these proteins are assembled by your own immune system that is resembling the antigen, right? But it's not really making you sick. It's just basically telling your own immune system that this is what the protein looks like and to start mounting that immune response. And then once that occurs, your immune system kind of kicks into action with antibodies and T cells that start training the immune system for future potential attacks from the real virus. And that's how the immunity is made. The Novavax, which is the traditional type of vaccine that we've been getting for decades, is the type that, where they inject a version, inactivated spike protein, along with another ingredient that also helps stimulate the immune system. It's also known as an adjuvant. It's in all vaccines. And this leads to the production of antibodies and T cells as well, similar to the mRNA vaccine. But again, this is just a different method of getting that same result. And again, once this is done, the idea is that you have that hopefully long-lasting immunity against severe forms of the illness. But again, this also is an inactivated vaccine, so you cannot get sick from either of these, nor get infected from either of these. Next slide. So what would the ideal COVID vaccine look like? So ideally, of course, we want long-lasting immunity. We don't want to have to keep, having to revaccinate. We want few side effects. We would obviously want one that's easy to store and administer, because of course, there's a lot of issues in terms of cold chain and keeping things under control. And so it's always, some of the vaccines, such as Pfizer, have been very difficult to store because they have to be kept in sub-zero refrigerators that most facilities and doctors' offices and things don't have. So this might be a niche for Novavax in that it's easier to have in areas where those cold chain issues occur. So low and middle income countries that just don't have the capacity for cold storage, it would be a lot easier for them to kind of store these vaccines and administer them. Next slide. So again, this is a much older technology. It's a great option for people who've had adverse reactions to mRNA or are hesitant. And again, these tend to have less serious side effects because they're less what we call immunogenic. So if you had very bad, side effects with some of the mRNA vaccines, you might tolerate this better. And there's no doubt that this also comes with side effects. Nothing is perfect, but for all three of them, I would argue that the risks far outweigh, the risks of not getting it are far more dangerous than the risk of any vaccine. It's because many of these side effects are, few out of hundreds of thousands or few out of millions. So whereas the risk coming from the real virus is much more common. Next slide. So in terms of treatments, treatment must be started fairly quickly, like within a few days of when symptoms develop, but any time is better than none. Of course, if you're already, vaccines are not a treatment, this is a preventative thing, but if you're already vaccinated, you're much less likely to get as sick. So the mainstay of treatment that we're using these days for the outpatients and people who are not in the hospital is Paxlovid. It's an antiviral. It can be used in age 12 and up. And it's important to start it as soon as possible because it helps drop that viral load. So the sooner you begin, the better outcome that you have from it. And it kind of shortens the duration of your illness. Now, people who are admitted to the hospital, there's an antiviral option as well called remdesivir. And that also should be started as soon as possible. This is IV, and it can be given either in the hospital or in a healthcare facility when symptoms start. So we even sometimes use it for outpatients that either can't get Paxlovid or are very sick, but it's IV, so that's kind of can be a limiting factor. And then finally is molnupiravir, which is an antiviral. This also should be started as soon as possible. It's approved in age 18 and up. And again, it's as soon as symptoms start, within 5 days of that, and you should take it at home, by mouth. It's an oral medication. So again, there are options. So, please get in contact with your physician if you do get sick, because you don't have to suffer, especially if you're high risk. Next slide. So moving on to influenza, this is caused by various viruses, because often, as we know, the influenza virus can shift within a season, and there can be different strains of it, and it spreads similarly by airborne droplets, by coughing, sneezing, contaminated surfaces. And again, the flu vaccine as well lowers the risk for severe complications. And high risk populations here are, children, which is unique to flu, as we do see pediatric deaths every year. And then any child of any age range, but especially those that are 12 months or younger are especially high risk. Pregnant women, adults over 65, and people who work in facilities with many residents. So like nursing homes, prisons, dorms, those type of areas. Next slide. And again, a lot of these symptoms can be very similar. So I've been advising people these days, since everybody's getting sick, is to test yourself. If you have an at-home COVID test yourself, because if it's negative, then we can diagnose flu, or if you can get to an urgent care and get a viral swab, that's also very helpful. And then the other thing I would recommend is just to look out for certain things like fevers, muscle aches. Usually flu almost always has a fever of 100 degrees or more. Again, nothing is an absolute, but headache, dry, persistent cough, shortness of breath, chills, sweats, tiredness, weakness, runny, stuffy nose, or sore throat. And this can also cause stomach upset, and as can COVID. Next slide. So prevention, very similar, avoid crowds, crowded spaces, get your annual flu vaccine. Masking helps for flu too, just like COVID, and maintain a healthy lifestyle too, all year round. So, everyone always asks me for quick fixes to boost their immunity, and there is no quick fix except the vaccine. That's the fastest thing. But outside of that, you just have to live healthy, meaning get enough sleep every night, drink enough fluids, take care of yourself, eat good food, healthy food. So unfortunately, there's no shortcuts. Next slide. So current vaccine recommendations for the flu is for everyone 6 months and up to get the updated vaccine. As we know, it updates every year. Those who are immunocompromised should get, the age appropriate one. There is the one that is a higher dose, or a stronger flu vaccine for those 65 and up. And then, so for those with an egg allergy, this is very important, because there's a big misconception that people with egg allergies can't get flu shots, but that is absolutely false. So even if you have an egg allergy, you can still get the flu vaccine, because there is no egg in the flu vaccine itself. So all of my egg allergic patients get it safely with no issue. Unfortunately, the medical community is still behind on this fact. And so often you may get asked if you have an egg allergy when you go for your flu shot, but there's really no reason to ask that. Next slide. So treatments, again, drink plenty of fluids, water, juice, warm soups. You want to prevent dehydration, get plenty of sleep, take it easy. Home. Any of these viruses, if you're sick, like rest is very important, and staying home is very important. So take care of yourself and not spread it to others. And then if you need pain relievers, that can help. Tylenol, Advil, etc. The mainstay of treatment is supportive care. A few individuals might be candidates for Tamiflu, which is an antiviral for influenza A, but again, it only works with flu A, and that also is time sensitive. So it has to be started in the first 72 hours. But if you're someone that's high risk, your doctor may opt to prescribe that for you. Next slide. So moving on to RSV, respiratory syncytial virus. This is a virus that's been around for many years, but people are kind of just kind of understanding it this year because now we actually have a vaccine for RSV. But this virus is actually just as many cases as flu and COVID. I would say argue even more cases right now than COVID, and it can have just as big a burden. So it spreads the same way with close contact. We're seeing a lot of cases right now spread by secretions from those who are coughing or sneezing. And we have vaccines now. So currently they're approved for age 60 and up, for pregnant women in their third trimester because babies especially are at high risk for RSV. So the nice thing is when you vaccinate the mom, the baby will come out and be born with RSV immunity because baby gets a lot of its immunity from mother, and certain high risk children are also eligible. So it's very important to know if you're somebody who is in a high risk group, because often people thought of this virus as a pediatric thing, but actually it can be just as dangerous for adults. And many of my colleagues who work in the hospital setting, pulmonology, critical care, internal medicine, they're all telling me that their hospitals are getting full with very sick adults with RSV, who are getting intubated, who are needing to be on ventilators because it can cause a secondary pneumonia, and it can increase your risk for lung and heart disease. Next slide. Symptoms, again, almost identical to all of these respiratory viruses: runny nose, coughing, wheezing, fever, sneezing. You can have temperature. And again, that's why testing is key here. So, because it actually, usually with viruses, they have to run their course and not much we can do. But in this case, I would strongly recommend at the very least taking an at-home COVID test, or if you can get to a medical facility and take a viral swab. It's helpful because now we have certain viral specific medications that you might qualify for. Next slide. So prevention, again, stay home, mask, wash your hands, avoid close contact with others, such as hugging, kissing, shaking hands, sharing cups or utensils, and clean, frequently touch surfaces like doorknobs and mobile devices, because that can spread by contaminated surfaces as well. Next slide. The two RSV vaccines that are currently approved are RSV by GSK and Abrivzio by Pfizer. They've already been FDA approved. They're recommended in CDC for adults 60 and up. And discuss with your physician if you should get the vaccine. Most people, I say yes, you should, because like I said, we are seeing adults get very sick from this, but those highest risk groups are those with heart disease, COPD or asthma, anyone who has any type of immune compromise. But being sick, just being 60, unfortunately, puts you in an immune compromised state, because all of us kind of start to lose our immunity, general past that age. And then one RSV vaccine has been licensed and recommended for women between 32 to 36 weeks of pregnancy, and this will protect the infant as well as the mom. And there is an RSV preventative antibody that we've actually been using for years for infants and young children. It's actually a monoclonal antibody called Synagis. And we usually will give it to high-risk babies. So babies that are born with congenital heart problems, or who are immune compromised, or have another chronic illness that puts them at risk from getting very ill from this. Next slide. So again, the new immunizations from the CDC, highly recommended. I recommend it to all my patients. Again, adults 60 and up. Talk to your doctor first, but again, I can't really think of any reason not to get it. It can only help. For babies, again, depending on their risk factors, we might give a antibody to protect them, or all infants that are being born during the RSV season are getting this vaccine, and a small group of older babies too are getting it as well. And again, we're giving it to pregnant women, especially in their third trimester. Next slide. So again, the mainstay of treatment is supportive care. There's no antiviral, unfortunately, specific to RSV, like there is for flu and COVID. Again, manage fever, pain, drink plenty of fluids, and speak with your doctor, especially if you're not getting better, because then it might be a sign that you might have to go to the hospital. Sorry, I think I accidentally muted myself. What I was saying is, if you're not getting better, or you or your child aren't, please speak with your doctor, because it might be a sign that you have to go to the hospital to get more in-depth care. Next slide. So the three important health issues, how can we tell them apart? This is the million-dollar question. Next slide. There are some telltale signs, but as you can see, there's very similar symptoms across the board. You know, fever, chills are in all of them, sore throat, pretty much almost all of them, cough, all of them, muscle aches, 2 out of 3. So this is why the testing is so key. And we can still get free tests delivered to us from the government, you know, so it's another reason too, that if you are somebody who is eligible for that, to please make sure that you, which is everyone, I think, can get 4 free home tests, that to make sure that you get that done, you know, and get those tests. Otherwise, most urgent cares, some primary cares, ERs, they can do the respiratory viral swab as well. Next slide. All right. And again, these are just some more symptoms, but many of them are just identical between each of these subgroups. So I always recommend testing. It's almost virtually impossible to tell if someone calls me with these symptoms, because it can be any of the 3. Next slide. And now I wanted to just briefly touch upon long COVID, because many people, you know, I know are over COVID in general, but this is still an important topic, because despite, you know, all the morbidity and mortality from COVID, long COVID still remains an issue. And many people are suffering even years after infection. Next slide. So long COVID is broadly defined as signs, symptoms that continue or develop after acute COVID-19 infection. And it's usually like a month after.
Dr. Parikh, I think we lost you. Dr. Parikh.
Oh, sorry about that. I don't know why it keeps muting. But these symptoms are usually occurring about a month after, if they're persisting a month after the COVID infection, it counts as long COVID. Next slide. So post-COVID conditions, they have different names now. Long COVID, post-acute COVID-19, long-term effects of COVID-19. It's also known as chronic COVID or post-acute sequelae of SARS-CoV-2 infection, or PASC. That's the official name. Next slide. And the symptoms of long COVID can include post-exertional malaise, fatigue, brain fog, dizziness, GI symptoms, palpitations, changes in sexual desire or capacity, loss or change in smell or taste, chronic cough, chest pain, and abnormal movement. So as you can see, it affects every system from head to toe. And majority of people with post-COVID symptoms are PCR negative. So again, this isn't the active state of the illness; it's the post-COVID state. So you're not contagious during this phase, but can be just as debilitating or even more so than the acute infection, and last even weeks to months or even years, as we're seeing. So post-COVID syndrome is a time lag between the microbiological recovery and clinical recovery. And majority of those with long COVID show both biochemical and radiological recovery. Next slide. So 11 things that doctors have learned from a recent study in long COVID is that fatigue is the #1 symptom seen at the clinic, which I would agree with. That I see that very commonly. SSRIs can help some, and symptoms are not generally caused by widespread inflammation. Inflammation is actually rare. Initially, we thought it was an inflammatory illness, and there's no typical long COVID patient. It can affect anyone. Most of the patients generally are not obese or diabetic or have any specific risk factors, but we have seen that in women, more so than men, it can be a little bit more common as well. But again, we're seeing it in all age groups and all individuals. Next slide. Sorry, I don't know what's going on with the, oh. Sorry, my slide seemed to, okay, there we go. So what we have learned about this as well is that exercise can help. There's some improvement in some individuals after getting the vaccine, and it could be due to a reactivation of a previous virus. Next slide. There's no test, unfortunately, available for long COVID as of yet. It's most largely a clinical diagnosis. Hopefully that we'll have tests in the long run, and there's no clear treatment, one size fits all treatment. So we're using all different treatment modalities. Most do get better, but it does take a while. And some are lucky in that eventually it gets better on their own or they have minimal symptoms. Next slide. Oh. So what does the future hold? I know everybody is kind of sick of this, but we're in a much better place now than we were before. As Dr. Fauci says, that in the absence of a dramatically different variant, we're moving towards a place where it's more of an endemic rather than a pandemic, and the vaccination will be similar to the flu vaccine, where we get updated shots on a yearly basis. Next slide. And then where do we go from here? Next slide. So again, we're moving from pandemic to endemic. We need to be prepared for everything. So that's why I recommend all 3 vaccines, because these are endemic viruses that we're going to be living with for the indefinite future. So make sure you get them early. They take about 2 weeks for you to become immune. So if you're planning on traveling during the holidays, now is the time to get it. Because we're getting close. Make sure you practice good hygiene, wash your hands, wear the masks, and stay on top of the current spread and treatment, so keep an eye on your local public health department's recommendations. Next slide.
So, Dr. Parikh, this is Dee Dee. Before we go on to our next few webinars, we have a couple of questions we'd like to touch base with you about. One of our community partners is asking, if someone is scared of having myocarditis, is it okay to get the Novavax instead of the other COVID vaccine?
Yeah, absolutely. And I actually recommend it to those individuals who have a similar concern, because
Mhm.
I find that the immunity is just as good with the Novavax as the other vaccines. So yes, it's nice to have that option. So absolutely, it's a great vaccine.
Great. And then another question that we have here is, we know that there are COVID treatments that you discussed earlier. If practitioners aren't offering the treatment, can the community themselves ask for it? And if so, how should they go about doing that?
Yeah, absolutely. So if you, and we have hit that roadblock where sometimes some providers for some reason don't offer it. But if you get turned down, there are a lot of other ways to get it. Most urgent cares will provide it. Now there's a lot of telehealth platforms where you can call and, they're able to get it. It's better to go to an in-person place because then they can test you and see exactly what you need. But if you do have a positive at-home test, you can use one of the telehealth platforms as well.
Okay. Okay. Thank you. And is there a magic time to receive the flu vaccine?
Yeah, so ideally, September and October are best. But I know now we're in December, so if you haven't gotten it as soon as possible is best because the flu season is going to go until March or April. And right now we're seeing cases peaking. They're already up
Right.
30% from the week before. But usually September, October is the best time to get it. So then you're covered for the whole season.
Okay. Yes. Yes. Absolutely. Absolutely. Someone has typed in, now that the FDA has ruled phenylephrine as an ineffective and major pharmacies have pulled it from the shelf, what should be recommended in its placement for nasal symptoms or relief for any of these conditions?
Right. Excellent question. So I actually recommend a lot of the over-the-counter nasal sprays that are not Afrin. So Afrin, which is
Mhm.
pseudoephedrine, is in the same class as phenylephrine, and it's not good for long-term use. But what I've been recommending is Astepro or Azolastine nasal spray, which is an antihistamine that's available over the counter. Also, all the nasal steroid sprays are very good for even cold and flu symptoms, such as Flonase, Nasacort, Nasonex. These are all over the
Mhm.
counter now. And believe it or not, the 24-hour antihistamines like good old Zyrtec, Allegra, Claritin, those go a long way as well for congestion. And I
Mhm.
would, if you can, avoid the ones with the D on it because again, that pseudoephedrine can have side effects for some people, such as like increased heart rate, high blood pressure, etc. So, but the plain antihistamines are very good, as well as the nasal sprays that I mentioned.
Mhm. Mhm. Absolutely. Absolutely. We have someone asking about, could you share why COVID may cause someone to experience intermittent sharp mid-sternal pain?
Yeah,
Is
so
that-
it is a respiratory virus, so
Mhm.
that causes inflammation. So it's not usually for any of these. It's not the virus that is the problem. It's the inflammation that comes along with it that's so dangerous. And so that's why people get substernal pain is because all of your lungs are inflamed, all your muscles around your lungs are inflamed, and your heart can even get inflamed with COVID too. So everyone is focused on myocarditis from the vaccine, but it's much more common to get myocarditis from the actual COVID virus
Mhm.
and other inflammatory heart conditions. So all of those things can cause that substernal pain. Usually it's not anything to worry about, but if it is very severe, please seek medical attention because there can be cardiac involvement.
Mhm. Mhm. Absolutely. Well, thank you. A couple other questions that we have here. One is, what are your thoughts about pulmonary rehabilitation for long
Mm-hmm.
COVID?
It's very good actually. So it depends because people have very different symptoms. But the patients that I know that have like things like shortness of breath or fatigue, the pulmonary rehab does go a long way, especially if you're someone who had pneumonia from COVID or
Mhm.
lung manifestations of your COVID-19. The pulmonary rehab can be very helpful in recovery for sure.
All right. Another question is do you know of any resources that parents who have a child diagnosed with long COVID in delaying their return to school? Is there anything that we should be telling our community about delaying the return to school if a child has long COVID syndrome?
Well, usually, yeah, that's a good question. So it's usually kind of decided on a case by case basis, and there is, you know, a leave of absences for people with long COVID or a disability available for adults with long COVID. But what I would do is discuss that either with your pediatrician or your primary care doctor, if that is necessary, and that may be necessary in some cases. But again, it's really that decision is made on a case by case basis, because not everyone with long COVID may need to do that.
Yeah, absolutely. I appreciate that. Well, I recognize that we are done a little early. I don't see any other questions. I don't know if you have any other last minute statements you would like to share about these 3 viruses or treatments.
Sure. I know the main thing I would say is, you know, please get your vaccines. I know the uptake on especially the COVID boosters is very low. I think the most recent number I saw was less than 20% of Americans have received the updated one. So please just, you know, get all 3. It's okay to get them all together. I personally like to separate them by a few days or a few weeks because, you know, I'm an allergist and I always think about, you know, how someone will feel afterwards. But it's not too late if you haven't gotten any of them. So please get them and encourage your family members, especially as we move into the holidays, because even if you might not be high risk, you might be meeting with somebody who's high risk, like your grandmother or a new baby that's born in the family. So it's a village, takes a village, and we should all protect each other. That's the last thing I would say.
Absolutely. Well, thank you, Dr. Parikh. This has been extremely informative. This is our last webinar of 2023. But we have several webinars coming up at the beginning of 2024. The first one is Not Everything That Causes Asthma. That will be presented by Dr. Nancy Joseph on January 11th at 12 p.m. So note the time change for that one. Then we have Dr. Kimberly Blumenthal presenting on the importance of proactively addressing and delabeling antibiotic allergy on January 29th at 4 p.m. You'll receive an email from Zoom in a few days with a link to the recording, the evaluation, and all supplemental resources. Thank you again from all of us at Allergy Asthma Network. Join us as we work every day to breathe better together. Thank you.